lot of folks during COVID, could work remotely. There's a lot of second home ownerships in Vermont and Maine, and a lot of sort of tourism, and people came and found that it's lovely, and then they wanted to own property there. So it's really priced out a lot of just locals or even folks that want to come and live and work there. So we have a story, actually a physician recruited on the Cape. So a lot of people don't think of Cape Cod as a rural place. The summer it's booming and all the people come to visit, but in the winter, it's really just the local people.
Oh, wow.
And it's the population dips quite drastically. And so they had recruited a physician and even at that level could not find affordable housing. So it accepted, planned to come there, and then there was nowhere for them to live and move with their family. Yeah. So it really has priced out a lot of the workforce. Even at the lower levels, there's nowhere for nursing, medical assistant, even mid-level physician assistants.
So we've talked a little bit about other rural and suburban communities and what their workforce challenges are. Paint the New England unique flavor of that challenge.
New England, I think if people think, New England's, close to Boston, it's not rural, there's not access challenges, but definitely is. We have an older population, definitely chronic conditions, really sick, ill, a lot of social determinants of health issues. So primary care is a huge challenge for us, but all the way down, we can't find billing staff, medical assistants, front desk folks. So it really is, I think, just a sort of facility-wide shortage problem. And so what we're trying to do is really just provide training and education and grow people from the community. I know when I grew up, I didn't think I wanted to work in healthcare at all. I definitely didn't think I wanted to stay in my community. But after college, came back and worked at my local community health center, my FQHC, and fell in love with it. And so I think we're trying to give students that exposure early. So we do a lot of internships, preceptorships. We do a large student summit where we just bring sort of interdisciplinary, just what is it really like to work as a part of a rural team? And so whether that's community health workers, social workers, and physicians, all.
What does the students mean?
So we have a lot of rural Scholars Pathways programs that we work with.
High school?
We start at the college level.
Okay.
We're talking about how to, engage them earlier and working with our AHECs, so our area health education centers, and they do more of the high school. But
here we're talking college.
Yeah, more college level, even graduate level.
Okay.
But exposing them to rural, so we'll take them out to our board member, Kirby Lisi, is also the director of the State Office of Rural Health in Massachusetts, and she has a side hobby. She runs a farm. So we bring the students out to the farm, they camp out and they get to experience what that's really like. And then they'll go out and do some community events as well.
How many of them are I don't want anything to do with this?
No, they love it. Okay. Yeah, they really do love it. A lot of them come from rural communities and grew up that way. So they already are connected to that. But once the ones that aren't experience it and they see the lifestyle, and it's more about, being outdoors and the hiking and that they just fall in love with it. And so one of those students, we got connected in with the association. He was a mentee of our executive director, Andy Lowe. He really fell in love with it. We started giving him some projects around advocacy and telehealth for older adults.
Okay. Audio
only was really important, payment parity for audio only telehealth, because a lot of older adults can't even log on to their Zoom, their telehealth visit. So that student focused on that. He was also then named the National Rural Health Association Student Leader of the Year. And now has gone into rural practice. So we just like to see their progression and provide leadership and other opportunities to keep them.
You've been amazing. Thank you so much for what you're doing.
Yeah.